Well, family is good. Only my wife and I are in the same place. And so we spend more time together in the last 2 weeks than we have in the last 6 years. So it's been interesting. The lockdown itself has had great leadership from the political class and the business classes, but it has had challenges in terms of it's easy to think about people who live in the suburbs, but difficult to think about people in informal settlements, difficult to understand what their daily existence is like, and therefore what social distances might or might not mean in that context. And also interesting, challenging in terms of managing public transportation, the modes of public transportation, and some of the expectations expose interesting labor standards, because taxi drivers, after the first couple of days, wanted to boycott carrying the essential services workers because this would have actually cost them a lot of money. So in essence, it's an interesting, what you've seen is a huge response from the corporate sector, 2 billion rands put on the table by Patrice Motsepe and the Oppenheimers, and a lot more people are coming through. South Africa set up a solidarity fund to which many actors are contributing. But much of the focus until the last week or so was on how to keep the corporate sector, how to keep private sector afloat. And of course, accommodations have been made with time to informal sector, small to medium scale businesses. South Africa is unique in many respects. And as we discuss the rest of the African continents, you realize that everybody's talking about the urban population and coping mechanisms. There's very little attention being paid to the rural population, or folks who live on farm plantations. Yeah. I'm going to say something that's going to startle many people. So in the responses, other than Tanzania, the liberation movement, other than Tanzania and Zimbabwe, and maybe Mozambique, the liberation movement leaders, former liberation movements, have done exceedingly well in terms of, and part of that is because they have adopted almost militarized biomedical response. They looked at coronavirus as an attack on security, and the response is they went into soldier mode. What do you do in order to deal with an attack? So Kagame, you saw that it's almost like he's in a battlefield. Yes. He's thinking, if you're in a battlefield, you secure territory, you secure people, you secure support of the masses. Yeah. You neutralize advance of the enemy, you take the most extreme measures. So you see that what you saw was, yes, a commandist military response in terms of management of public interaction, social distancing, and its implementation, and the logistical complexity. But number two, what you saw was the immediate move of distributing food and other necessaries to people who might need, the vulnerable, because they have many pre-existing vulnerabilities. Like in many, the interesting thing, there's a difference between how Kagame has responded and how Ramaphosa has responded. So Ramaphosa's response was bring everybody, opposition political parties, religious leaders, bring private sector, talk to taxi owners association, the Matatu owners association, have a consent of sorts, and then build a war chest around a national fund to fight this. Now, it's an interesting because South Africa has that luxury. It has a huge private sector with significant amount of resources. Smaller countries like Rwanda have a private sector, not as big. So what they have as a resource is the Rwandan people and the Rwandan state. I mean, the Minister of Health in Uganda comes out of this as one of the superstars. Uganda might not have the lowest numbers in terms of management, partly because the political class itself was not entirely complying with some of the restrictions that have been placed on the population. But she was one of the first off the blocks to say, we're going to manage flights from risk countries before South Africa did, before anybody did. And what the Ugandans have done is they've mastered communication, this engagement with the public, explaining what's going on. And you can see everybody else, whether it's the Rwandans and the South Africans, learning from this. There's constant communication, constant explanation, constant outreach, being on the ground, being seen to be doing something, showing that you are serious, showing that there's no favoritism in what you're trying to do. And of course, Museveni has come alive. I say there are two leaders who've been made by Corona, by COVID-19, and I say this in jest. It is Ramaphosa and Museveni. Ramaphosa was facing a lot of challenges within the ANC and outside the ANC, but he's risen to the occasion here. Museveni, we saw him doing press-ups, showing his feet, explaining to the people what to do, engaging his people. But there is someone who perhaps, for me, may have a challenge internally, but in terms of Pan-Africanist response, has been a model. That's Abiy. So when everybody else was looking inward, shutting down their borders, closing their country, fearing other Africans and foreigners generally, Abiy was talking to Jack Ma. I wish he had been talking to the African billionaires, but he was talking to Jack Ma and others about getting support, not just for Ethiopia, but support for several African countries. And this is what was missing here. And then, of course, the interesting thing that his engagement with the Orthodox Church in Ethiopia, many of us did not think that he would pull it off because of the tensions in the country. He was able to. The Orthodox Church response in Ethiopia has been phenomenal. It's not 100% compliance. I mean, Ethiopia, like Nigeria, 100 million plus population, it's not easy to deal with. Smaller populations. Botswana, what we've seen is an integrity of leadership. He goes to Namibia and comes back and says, because Namibia had a case of COVID, I'm going to self-isolate as the president. So it's the first case we've seen in Africa of a president. We're talking about Africa here, self-isolating. Before Boris Johnson, before Angela Merkel was talking about self-isolation, we have the Botswana president saying, I'm self-isolating because, and you contrast this with the governors, some of the governors and the MPs in Kenya, and the attempt sometimes to suppress information, to bypass regulations made for everybody else. And I think that Botswana, there are questions. The Botswanas I've talked to, so they are on lockdown almost for 6 months, or at least closed down bars, no sale of alcohol. And if you know Tswana culture, the question is whether or not this is not crazy. I mean, to say you are not going to drink, you are not going to, we're closing schools. But what he's done is they have a lot lower number of COVID cases than most of the other neighbors. But they've taken, I think, in terms of preemptive action, they've gone beyond what countries, their neighbors like Zimbabwe, like Malawi and others should have. The other country where perhaps interestingly, where you are seeing leadership is what we're seeing from Tunisia. What Tunisia has been trying to do is to use the United Nations to get resolutions for collective action, global collective action on COVID-19. Now, of course, the consensus on this will be difficult. Tunisia has to remember it is part of Africa, come back to the African Union and get a consensus. The African Union is going to insist on 3 things that may be difficult to get past the United Nations. The United States, the Security Council. Number 1, as Russia and others have said, sanctions that are on countries like Zimbabwe, Cuba, encumber or hinder the capacity of these countries to move as swiftly as they should.
That's right.
Well, of course, it's a fair point. One knows that it's overplayed, but it's a fair point to make. Number 2, that because of their friendship with China, they're not going to accept the reference to COVID-19 as a Wuhan virus or Chinese virus, right? And number 3, it's this whole issue around leadership that you're seeing that's beginning to think it's a global pandemic. Africa shouldn't be paying the cost. There is a collective responsibility from others. And I think that's interesting. Ghana, too, Although I think that the complexity with how Ghana has approached it is if they had adopted bits and pieces of what we saw in Kenya. So what has Ghana done, which many people have not paid attention to? So Ghana's first protocol was, if this is a war, our frontline soldiers are the medical professionals. So let's cushion them against concerns, against personal risk, concerns that relate to their livelihoods, their families, and their income, because we're expecting a lot from them. So it declared a set of measures that they would get tax exemptions, they would get certain benefits specifically for the health workers. And I think that these piecemeal approaches and sometimes the collective approaches are beginning to model two things for us. Number one, they're beginning to do two things for us. Number one, they're exposing the ineffectiveness, inefficiency, outdatedness, and incapacity of leadership. Number two, they are exposing what kind of innovativeness you get from citizens and leaders when they are faced with crises. So that's why I jokingly say that COVID created Ramaphosa. So there are many people who are saying, oh, is he really a good leader? Can he lead? But what this has done is unite a lot of people behind him. Put him 7 years, I say, that the sort of very self-indulgent, it's all about himself, communication that had become characteristic of him, there is a shift. It's still about himself, because I think that this narcissistic approach to politics is addictive amongst many of our leaders. But you can see him come alive, you can see him recreated. And this is ironic, because the crisis in the health sector in Africa is the responsibility of the IFIs, the international financial institutions, the IMF and the World Banks, that in imposing the structural adjustment programs. It is one of their demands, this investment in social infrastructure, right? And this idea that economies would be driven solely by investment in the productive sector. And I think that that's an important point. But number two, the crisis in the health sector is also that in the public sector salary and benefit structure, the member of parliament and the cabinet minister takes the lion's share of what is paid.
Yes.
So we have in a sense, teachers don't matter, health workers don't matter. The critical services that keep us alive and make our nations to develop, farmers actually don't seem to matter. If you look at, on average, what the farmer who produces the food we eat gets and what a member of parliament gets for going to sit and steal, it's a huge difference.
Yeah.
So what COVID-19 is doing for us in terms of leadership, it's questioning two things. Where should leadership be? What should leadership be? What kind of leadership do we need? Now that we know that if you elect fools and idiots, when you have a crisis, they can't help you.
Yes.
It has done something else that's not related to political leadership. So our countries have become hostage, and I mean no disrespect to those that are any faith or the other, have become hostage to hyper-religious authoritarianism, I'll call it, right? Whether it's Pentecostalism or some form of Islam. So our people were not producing. They were not paying attention to anything else except going to church. The only strategy was prayer. And they were captive to these people that were called Papa, men of God, whatever you call it. Now, the lockdown has essentially decoupled the people from their papas and left the people with their families and faced with personal existential crisis that they have to navigate without deference to this capture. So we had a multi-layer capture of state by the political elite, capture by the corporates and economic elite, and capture by the religious entrepreneur or faith entrepreneurs. Now, what has happened in this season is the citizen find themselves alone. And critiquing Papa is not even, Papas are not talking, all these prophets, and nobody's saying, I will heal all the coronavirus. They're hiding themselves, afraid to get it. So in a sense, it's been an equalizer, apart from giving Nairobi, Harare, Johannesburg, an opportunity to to breathe. I mean, the levels of pollution are much lower. The levels of crime are much lower. The levels of noise are much lower. So I think the greatest leadership has come from this realization that when an existential threat is facing everybody, we are all equalized. No one claims to be messianic. I think that I was startled, actually, that given the number of persons from high-risk countries, whether it's Italy, China, Spain, and some of our African countries. So let me mention some. I think Mozambique has been slow to the response. I think Malawi has been slow to the response. I think Burundi, with all the hype and the response amongst and around its neighbors, has been slow to the response. Yes. Nigeria has done only 9,000 tests in a population of 150 plus million. I mean, unless they know something that we don't. So, perfect. Nigerian business, Nigerian citizens, the response has been amazing. Yeah. Offering their hotels, offering places. But the response from federal government, the response from the leadership has not been, and partly we're seeing those countries that have a high levels of corruption, limited levels of public accountability, limited levels of access to information for ordinary citizens, have been tardy in their response. In fact, some of them were hoping that this, like Trump said, is a flu, it'll go away. And some of them were suppressing information. So as this thing bolts out of their control, number one, but number two, as some of them think there's going to be some money that you can get from some big fund, there's now a beauty contest to say we actually do have COVID-19 cases. So if you take the Zimbabweans, for example, it's not clear why the host of Victoria Falls. So in terms of tourism, once you've taken out Egypt, you've taken out Kenya, you've taken out Botswana, you've taken out South Africa, Mauritius, and you've taken out the islands. Zimbabwe, Ghana, and those countries would be high up there because the number of tourists going to Victoria Falls per year is about 2 million, right? Just Victoria Falls, that's just one tourist. Their Bay Bridge border, the number of people who go through the Bay Bridge border per day is 60,000 plus, right? So that they were not doing testing, that they were not prepared is phenomenal. I mean, it's either just reckless lack of foresight or simply splendid irresponsibility on the part of the leadership. And those countries with the weakest health infrastructure have also been fairly slow in response. I think DR Congo was slow in responding. And given the fact that it was faced with conflict, and DR Congo also had an outbreak of measles, right? And it was still battling Ebola. I'm surprised that the response was this slow, and the boldness of the measures taken were also limited. And I think Burundi, with the greatest of respect, I think Burundi is still concerning itself with the election. Burundi has not paid sufficient attention. The reason why there may be low cases in Burundi may be partly because the testing capabilities are low. Lesotho and Comoros, as of yesterday, were the only two countries with zero COVID. And now, Lesotho has only one neighbor, right? If you go out to the north, to the south, to the east of Lesotho, you end up in South Africa. Looking at the rate of COVID cases in South Africa, I am hard-pressed to accept or to believe that Lesotho actually has zero COVID cases. But the businessman in Lesotho provided the answer. So he offered 25 million rands to pay for a testing center because there is no testing center for COVID in the whole country. So they had to take their samples to South Africa for testing. My view, John, is state fragility is not only the result of externally driven or imposed policies or conflict. We're seeing that some countries in conflict have shown a little bit more seriousness, right? Of course, I forgot South Sudan, which I think its narrative is a bit interesting. So South Sudan, first case recorded is a UN employee. So South Sudan, within the public, the UN brought COVID here. And then, of course, they keep on. I think there's a measure because the state is still in the state of formation, is not taking this as seriously or putting in place the capacities and competencies. The countries that would normally support South Sudan are busy with their own problems, so they are unable to play. And South Sudan and Comoros may be in the same position. Contested political terrain. There was an election, as you know, last year in Comoros that was contested, and Comoros is one of the poorest. I mean, the statistics suggest that 50% of the population lives below the poverty data line. Health infrastructure is weak. Their response, like South Sudan's, like I said, we saw in Lesotho, and we're seeing in Mozambique, has been disappointing. Disappointing because you know the extent of your problem in terms of health infrastructure and capacity. You know the extent of your problem because you're countries that are nourished by constant streams of tourists. You know the extent of your problems because of the economic challenges that you face, and yet you don't prepare to do anything about it. I mean, it's been very disappointing, and even more disappointing is not just the lack of leadership, it's the lack of seriousness, absolute lack of seriousness in some of these countries. I think COVID is going to represent, John, the biggest critique or the biggest support of the Kagame reforms to the African Union. Those of us who have worked with the African Union Commission and around the African Union Commission will tell you this. It functions on body language. It waits to hear. So ideally, that secretariat ought to be empowered to make decisions, to move, to implement those decisions. But it functions on the body language. It waits to see what the member states, especially the PRC, thinks, and would not dare contradict the PRC. The disproportionate power of the permanent representative committee or council over the secretariat is an anomaly. If you want a Pan-African body that can help the continent respond, you cannot keep it hostage to the control of ambassadors for two reasons. There is political direction, there's political guidance, and I think that role the ambassadors should play. But there is functional competence, coherence that should be controlled within the secretariat. So let me give you a sense. As all the member states of the African Union went provincial, looked inwards to deal with their own national crises, no one was paying attention to the continental picture. And the AU Commission's job and mandate would have been exactly that. When member states are preoccupied with the internal challenge, the secretariat, which ought to be made of highly competent technical experts, not political appointees who are busy peddling political influence, red tape, and bureaucracy. The technical arm of the union would have been able, number one, to do the policy documentation, to do the guidance that says to the member states, we've done the analysis. Having a bird's eye view, this is the best way to respond. This is what a competent continental response would look like. This is what we will need by way of resources. This is where we have the biggest vulnerabilities. This is where we have some strength. So it would have been able to do that scoping. It would have been our war room. Unfortunately, it was waiting for member states, so it couldn't decide until Ramaphosa had called a meeting. Ramaphosa couldn't call a meeting until he had addressed his national crisis. So the question we will have out of COVID is what kind of East African community, what kind of SADC, ECOWAS, SANSAD, or AMU, what kind of African Union do we need in order in the future? Should we be faced by or with a challenge as big or bigger than COVID-19? What kind of entity with what competence and mandate do we need to protect Africa, to enable Africa, and to inspire Africa? Here, unfortunately, they have failed. We thank God for the response. It's rather belated. But what is that response, John, that they have made, right?
Yes.
Number one, they have set up this public-private partnership with the Afro champions to establish a fund.
Yes.
Now, the fund, we will have initial phase 150 million. They are looking at a maximum of 400 million.
Yes.
Now, before I go on to say what this will be for John, the South African private sector offering of 2 billion rands, right? 1 billion rands, unless if my math is wrong, is about $100 million.
Yeah.
So South Africa, for a South African response, is using 200 million rands. Now, so what would 150 million rands do for 55 countries, right? So I'll come back to that. And then the second thing that you have is this first 150 million is to meet immediate needs to prevent transmission. That means you're talking about testing kits, you're talking about PPE, you're talking about all sorts of things. Sorry, it's a helicopter that's, yeah. The phase two, the 400 million, John, is a sustainable medical response, pooled resources for procurement of medical supplies, commodities, deployment of rapid response responders, socioeconomic support to the vulnerable. This is a joke, John.
Okay.
If you take Kenya alone, what it will take to support the informal sector in Kenya, don't even cross into Tanzania, $400 million for a continent of it. So first, I mean, the devil is in the detail. It is clear that after you've brought, let me give you a sense, one ventilator cost about between 13,000 and 16,000 US dollars. After you've bought ventilators, just for the East African countries, never mind the small island states and everything, how much change will you have on 400 million? I mean, for the poor, remember the promises that they'll give to the most vulnerable groups.
Yes.
We haven't even talked about countries still in conflict, and it seems to me that the ambition in the figure is either misleading or there was a typographical mistake, right?
Yes.
In the statement. Otherwise, it will be. Fundraisers may say you have to start somewhere with a realistic target. My sense is this target is not realistic because it's not benchmarked towards actual needs.
Yes.
We couldn't meet, yeah. So anyway, so this, it's, the AU has two ambitions: set up an autonomous strike force. Their realization, rather late, is that America is not coming to save us, nor is the EU,
nor
is China. They have their own internal problems. Yeah. So we need to pool resources and expertise and respond as a collective to where we have challenges on the continent. The second thing that they wanted to do is, sorry, before I go to the second thing, now think about this, John. The underinvestment in research and development, generally, before we go to medical research and development in each of our countries, is phenomenal. So which expertise and resources that they have not invested in over the last 30 years are they going to be pulling in, right? We had a health strike in Zimbabwe where the government was saying they can go to hell. We're not going to increase poorly paid health workers. Privatization that we were seeing in Kenya of the health services, almost gone rogue. I mean, and the same challenge we're seeing in Nigeria, we're seeing in Egypt, we're seeing. So which expertise exactly are we going to go back to? Because we've not invested in it. I'll tell you what, when you go to the next, which is, because this is a financial instrument to mobilize money from the private sector.
Yes.
There is something fundamentally wrong in the logic of our leaders.
Yes.
Let's do basic math. If I ask every single one of the 1 billion Africans to try and give me $1, $1 US, as part of their contribution to a fund, I would have 1.2 billion. we're going to some of the people who caused the problems and saying they should solve it with 400 million.
Yes.
It makes no sense. Our government don't seem to realize that the most effective weapon in fighting COVID is the African peoples themselves. If there's no behavioral change from the African people, COVID will spread.
Yes.
If there's no trust in government and leadership in the war against COVID, COVID will spread. If there is contribution by the people, no matter how small, to social support at the community level, to caregiving at the community level, whatever people can give and can contribute, COVID will be defeated. So there is always this, it's a very narrow functionalist thought that thinks we have a problem, let's throw money at it.
Yes.
But we have a problem, let's for a change. The greatest moment of African history and Pan-Africanism was at the early moment when liberation movements, independence movement were being set up. The leaders were connected to the people.
Yes.
And the leadership were concerned about moving the agenda of the people.
Yes.
COVID is not killing animals, it's killing African citizens.
Yes.
To try and find almost a messianic solution that says we're going to get big money folk to solve the problem for the masses is either idiotic or simply short-sighted.
Yes.
So that AU response for me necessary, and it's an opportunity. But here is the other linkage. The AU has a huge program on ensuring so many jobs, 20 million jobs, I think 2 million jobs by the year 20 something for young people. There has not been a targeting of the young entrepreneurs who are developing PPE and other solutions in our countries, innovating around. There's not even a leveraging, an attempt to leverage young people that are designing ICT-based solutions for tracking, for testing. There's a huge, we're going back to big corporates.
Yes.
But we know from the experience of Ushahidi and others, that young people, we know from M-Pesa, right? That young people, and that's what's missing there. We have not even middle age, we're very old men gathering and determining that we're going to gather very wealthy people to give us big money. And with money, if money could solve COVID, America would have no single case.
That's true.
Right? It's a people solution, and that's what's missing. And in the people, three groups that are totally ignored. Who helped us fight HIV and AIDS? Who helped us deal with cholera? It was the women caregivers that the state allowed to bail out the state.
That's right.
If we invest in those caregivers, the state, because that's what we did wrong in the first response to HIV and AIDS. These women responded as a matter of necessity and incurred great risk. There was no tax benefit. There was no bailout. There was not. They carried the burden of HIV and AIDS.
Yes.
But we've learned from that. We've learned from Ebola. We learned from cholera.
Yes.
If we invested in those caregivers, they're there. They didn't die.
No.
Most of them. They're in the communities. So the AU has a response that does not refer. China doesn't have as huge a constituency of caregivers.
Yes, no, it doesn't.
Right? In the community.
Yes.
Italy doesn't have. Spain doesn't have. This is what makes us unique.
Yes.
So it seems to me, John, that the response itself is welcome, but the opportunity for CDC to function and make an impact, or for Africa to make an impact, means that not only do you pay attention to the youth and the women I talked about, John, we still import a lot of food onto this continent.
Correct.
The people we import from will have their factories shut for a month or 2 or 3. Their populations will have food shortages.
Yes.
So it seems to me, John, if anybody wants to make a difference, those smallholder farmers are going to keep us alive.
Right.
Right? I would be turning the entire insurance industry and the banking sector and whatever else I have and say, make sure they produce, right? Because we will need food. Forget this importation of rice. West Africa imports so much rice. We, unfortunately, don't have the luxury going forward. It's either if the food is available, it will be way too expensive for our economies that have been shrunk by COVID to afford. The reality, or the most likely scenario, is that there will be no food.
Yes.
Therefore, we have to look inwards and look at regional value chains. Where are the cassava growing and cassava eating populations? Where are the groundnut growing and groundnut eating populations? Where are the maize growing and maize eating populations? How do we move unga from between Kenya, Uganda, and all the other unga eating countries? We are still thinking at a very abstract level. The reality is, beyond the vulnerabilities to the informal sector from not earning income, there is a much more medium-term vulnerability. It's not just food systems, it's food sovereignty.
Yes.
If Africa doesn't have its food sovereignty,
yes,
whether it's in July or August or September, we're now going to have unga riots.
Yes.
In South Africa and in Zimbabwe, in other countries, the reason why social distancing has become a problem, you tell people you're going on lockdown, they don't have maize meal, or they don't have up, whatever you call it, or unga to make food for food. So they're going to line up for food.
Yes.
So you have thousands of people packed trying to find food.
Yes.
So John, the AU must remember, it is not in Wuhan,
No.
it is not in north of Italy,
No.
it is not in New York. If you are developing a response for a highly informalized African economy, but with a robust, if you like, smallholder agriculture system, you better invest in the thing that gives you the distinction and that guarantees livelihood. And that guaranteeing of livelihood will guarantee security. Many regimes don't realize this, John, but they are going to face riots and insurrection as a result of mismanaging that component of the response. I think that if one looks at the caricature of all this, some of the most poorly paid parts of the public administration are the security forces.
Yes.
Now, if you think that when we travel in Matatu, we are packed like sardines, wait until you see how police officers in a truck going to beat up protesters travel.
That's right.
So the risk of infection, cross-infection, the risk of community infection within the police and the military is huge. The risk of infecting communities. I mean, we had a problem of bribery and violence in terms of violent enforcement of the law. Now we have put it on steroids. It's on an industrial scale.
Yes.
And my sense is that we are sending these men and these women supposedly to keep the nation safe.
Yes.
But they are becoming human bombs, sometimes in terms of COVID, worse than, if you like, suicide bombers, because they don't know.
Yeah.
They are contracting and passing it on. Where do police officers live? They don't live in communities with small numbers of people.
No.
They live in communities with huge numbers of people. So the state is violating the integrity and livelihoods and the right to life of citizens in three ways. Number one, depriving people the ability to access food and means to sustain their lives. Number two, using violence to enforce such a deprivation. Number three, risking the contamination of the security forces who are members of the community, but two potential carriers of COVID.
Yes.
So in my sense, somebody must make an application, not simply to stop in these different countries, court applications, not only to ensure that there's water, like the Zimbabwean lawyers have done, and others, to ensure that there's water, that there's access to basic necessities for poor communities, but so that when police and army are being transported, they are not subjected to this risk. And somebody might say they assume the risk by virtue of the second caricature, John, about militarization is this, that authoritarian regimes that were struggling with opposition, if we look at the geospatial deployment for enforcement purposes, some of the enforcement has tended to concentrate in those communities that have proven to be problematic for the ruling elite. So we are using the guise of COVID and a militarized COVID response as a containment strategy for anti-establishment or oppositional forces. Yeah, we are actually also using COVID as an excuse in countries where people were at risk of not performing well in elections to postpone elections. Whole scale, it seems like COVID is either a pause button for the democratization process or it is a postponement of doomsday, in the sense that because of the militarized response, the anger will not abate. It will mount. And we will not know its extent because people are in confinement. But we will know the expression of the anger of the people afterwards, when they don't have food and they are bitter because they were violated and there's no legal remedy for the violations they suffered because you can't identify who violated them. I think that we've had the discussions, but not in full as Africans, as Pan-Africanists. On why certain rituals that we deem central to our existence exist and how they evolved over years. So let me give you an example. Amongst the Shona culture, you only shook hands when you went to a funeral. That act of empathizing, of shaking hands, that's how we describe when you say, I want to go and condole with someone, you say, I want to go and shake their hands. Our greeting form was this, right? We would, and we kept the distance. We would, how are you, John? You'd say, I'm all right, Brian. The women would do this. That's how we greeted each other. We don't know where that came from. Now, come the English. They found this so impersonal because they wanted to shake hands as a sign that we're in agreement, we're together. So we now have a mix of greetings, shaking hands and our traditional ones. And it's an important one. You go across various other cultures where they did not shake hands and where they shook hands. You realize that there's a cyclical evolution. But what's important is the underlying logic of values that we must not lose, whatever evolution is enforced or forced by, whether it's this pandemic or Ebola or something else. The one, I suppose, since English is an imperial language, we can make up words, and I'll make up two words. There's the fear of this desympathization of society. That means desympathization of society. Removing the nature of African society is a coexistence or a mutuality of existence based on solidarity, on empathy, on recognition, on respect, which then frames what the Maasai has a philosophy: the right to be, the right to become, and the right to belong. Now, in a sense, the social distancing must not lead to individualism and individuation. That makes us non-empathetic. When someone dies, we don't empathize because we no longer have the social mores or obligation that we had previously, that if there's a funeral, you have to appear. And the second word I want to make up is COVIDization. COVIDization of social relations, this idea that all relations have to be different because of COVID, right? It seems to me that we have two options that face us. The first option is we should not be stupid enough to imagine that there is a button that we will press that says return to factory settings after COVID is gone. Our lives have been changed fundamentally, but we shouldn't also imagine that we have to wait to discover. I think we must, in this instance of limitation, be imagining how else can we still express solidarity?
Yes.
How else can we still express empathy? How else can we still express our Africanness?
Yes.
Given the changed circumstances? It seems to me that thespians, media folk, social scientists must, even in the context of this COVID,
yes,
instead of us looking at what does it mean to have only 15 people at a funeral, what does it mean for us to be saying, how do we still convey and carry, right, the values that inform, so that future generations are not born without empathy? Because absence sometimes create the reason why Italy is such a sad case is because without the social support systems that we have in Africa, some people were dying in their flats, in their houses, alone.
Yes.
No care, no sense of care for your neighbors. The reason why the United Kingdom and portions of New York, right, that actually, and John, it's important to say this, apart from the bar, pub, and underground culture,
yes,
the American, European cultures were constructed on social distance, right?
That's very good. Yeah, never thought of it like that.
Yeah. So we ourselves must not assume that it is an answer in and of itself.
No.
Because devoid of the other values that I'm talking about that make us Africans, that it is a very sad culture. Can you imagine living in Madare, Korgosho, or living in any of the informal settlements, and your neighbor does not talk to you?
Yeah.
Or your neighbor keeps a distance, you are sick, they keep a distance, you are... No, we can't.
Yes.
But how do we, knowing the risks that we have, begin to construct a way of still showing the empathy, the solidarity, the togetherness? You know, John, the bulk of our population would be diagnosed as suffering from mental illness. The stresses of living in Africa.
Yes.
I mean, all these people from Europe before were coming to see disease in Africa.
Yes.
And death.
Yes.
The fact that we have smiling people when we live in the midst of such, look at the risk that we have from war to famine to disease, to Ebola. But in Congo, we still dance.
Yes.
Right? In Congo. You see, our society is the first medical cure that we have for our challenges and our culture. Yes. Look at the depression levels that will hit Asia and Europe, John, and America after experiencing such levels of disease and death.
Yes.
So my sense is social distances requires us now to do social engineering and social innovation.
Yes.
Based on primary values of what it means to be African.
Well, on that powerful note, as usual, Brian, thank you very much. I think you've hit the nail on the head. That really the answers are within us, and the biggest failure would be one of imagination at this moment. How do we recreate, reimagine, and sustain our cultural, culture of empathy during this disruption that has been caused by COVID. Thank you very much, Brian, for taking the time. I wish you all the very best. Stay safe, and warmest greetings to all your family. And I'm sure we will be speaking again very soon, where we all remain in lockdown.
All the best with the lockdown and all the deprivation it brings.
Absolutely. But it also provides the opportunity for me to be able to talk to Brian Kagoro and have a conversation about Pan-Africanism in the age of COVID. The new normal has started.
We are in it.
We're in it.
Thanks, Tara.
Thank you.